Number 6, the Honourable Ruth Dyson.
Thank you, Mr Speaker. My question is to the Minister of Health. Does he still stand by his statement in relation to health funding that the important thing is not how much extra money they're getting, it's what extra services you are getting as a taxpayer?
The Honourable Jonathan Coleman.
Mr Speaker, on behalf of the Minister of Health, as I replied to the same question yesterday, I tell you what, if you want to go on like that, we're waiting for Chris Carter to start telling the truth about you, Dazza. All right, so I'd get back into your box if I were you, buddy, because you're on his list.
I've got to confess I have no idea what all that was about. But order,
Mr. Speaker.
And the Minister does not need to inform me. No one needs to inform me. I'd rather ignore what that was all about, but I was on my feet and the Minister continued talking. He will not do that again. The Honourable Jonathan Coleman to answer the question.
On behalf of the Minister, as I replied to the same question yesterday, every DHB provides several hundred different services each year to meet the changing needs of their population. And under this government, frontline services overall are increasing, as has the budget, by $512 million this year. So I stand by that statement.
The Honourable Ruth Dyson.
Are the people of Masterton who are being turned away by their GP super clinic getting extra services, and if so, where from?
The Honourable Jonathan
On behalf of the Minister of Health. Mr Speaker, I cannot confirm the situation there because, of course, this is a question put on notice and there was no reference to what was happening in Masterton. But what I can say is that the people of Wairarapa have had an increase in funding from their DHB of $7 million over the past 2 years. So there is more money going into health in the Wairarapa.
Nikki Wagner.
Thank you, Mr Speaker. To the Minister of Health, what reports has he received recently on increased frontline services, particularly for older New Zealanders?
The Honourable Jonathan Coleman.
Mr Speaker, on behalf of the Minister of Health. Yesterday I advised the House that the number of patients receiving elective and acute surgery in the past financial year increased by over 12,000 over the previous year, more than 4 times the average achieved by the previous government. Today I can inform the House that in relation to surgical services for older New Zealanders, in the last 2 years, the number of patients aged over 65 benefiting from urgent and elective surgery increased by over 10,500 people. A record total 93,000 patients aged 65 plus benefited from acute or elective surgery in the last year. This is yet another example of increased frontline services under this government.
The Honourable Ruth Dyson.
Why has the Capital and Coast District Health Board, which lost its chief executive, who left saying he would not oversee further cuts, and has now lost both the acting chief executive and the chair, Sir John Anderson, is it because the Wellington region is awash with extra services or awash with health cuts?
The Honourable Jonathan Coleman.
Well, of course, what I can tell that member, the fact is that we were left a massive problem by the last government at Capital and Coast.
Order. I'm on my feet. An answer shouldn't start with a lecture about the last government. An answer should start with an attempt to say something about the question. I invite the Honourable Ruth Dyson to repeat a question.
Why has Capital and Coast District Health Board lost its chief executive, who left saying he would not oversee further health cuts, and has now lost both the acting chief executive and the chair, Sir John Anderson? Is it because the Wellington region is awash with extra services or awash with health cuts?
The Honourable Jonathan Coleman.
Well, what I can tell that member again is that Capital and Coast Health Board received an extra $24 million last year from this government, an extra $33 million from this government the year before, and that CE under the last government was dealing with turning around a DHB in terminal decline and the massive deficit that they had been lumbered with by that government.
That's right. The Honourable Ruth Dyson.
Is the clinical director describing Christchurch Hospital's intensive care unit as, quote, in crisis, and saying that the staff at the intensive care unit are turning a blind eye to care levels lower than expected? Is that a result of the extra services he was describing? Look at that.
Order.
Crisis.
Honourable Jonathan Coleman.
Speaker, I've read the same newspaper as that member. I've got the same article there. And the fact is Canterbury District Health Board's had an extra $102 million under this government, and they are spending that money as they see fit. Now, the Minister of Health has been in touch with Canterbury DHB, and as is quoted in that article that you're reading from, there is going to be a Christchurch Hospital redevelopment, which will include a significant redevelopment increase in beds. And I can tell you that that ICU has had an increase of 16 extra nurses, 7 extra junior doctors and an extra 1.5 full-time equivalent specialists this year.
The Honourable Ruth Dyson.
What extra services will the residents of Idea Services and Tamata Ho be getting as a result of his refusal to comply with the Employment Court determinations of last year and this year in relation to payment of the minimum wage for night-time support staff?
The Honourable Jonathan Coleman.
The Minister of Health, as the Minister of Health said yesterday in the House, that is a matter for the provider.
Order.
Actually, you signed it.
Order. I beg your pardon. Supplementary question, Honourable Heather Roy.
Thank you, Mr. Speaker. My question to the Minister of Health. What does it cost to select and run the 20 district health boards, and what extra health services do they provide?
The Honourable Jonathan Coleman.
Well, look, as you know, there's $1.2 billion going into health. It's a very expensive business. There's $1.2 billion of extra funding gone into health this year. $512 million over 4 years, $174 million for mental health. So more money, more operations, more cancer treatment, more people being seen in A&E. The public are getting better service under this government than they got under the last one.
Order. Is this a point of order? Point of order, the Honourable Heather Roy.
Point of order, Mr. Speaker. I think the Minister misunderstood my question. I wasn't asking about vote health. I was asking about the cost to select and run the district health boards themselves. I'm happy to repeat my question.
I'd invite the member to repeat a question because it may well be it was not heard correctly. The Honourable Heather Roy.
Thank you, Mr. Speaker. My question to the Minister is this. What does it cost to select and run the district health boards, and what extra health services do they provide?
The Honourable Jonathan Coleman.
Well, if she likes to submit that as a written question, I'd be happy to apply the figure.
Question number 7, Melissa Lee.
Thank you, Mr.